Rokupa is a hospital that is already started to do what from April 27th will then be for the whole country. So what they're doing is they're providing free treatment for pregnant women and children under 5. If that happens across the whole country, then you're going to have a greatly increased benefit. So here what they're doing is specifically for the pregnant women, right? They're providing that free healthcare. Now from April 27th, for pregnant women and for children under 5, it's going to be rolled out across the country. But what they've shown here is that by doing it, providing the free care, you multiply enormously the number of people come and use the service, and therefore you save lives.
The government has proclaimed to the nation that there is a free medical service for pregnant women, lactating mothers and children. What is your support to the government initiative in achieving these free medical services?
Our support is really because the government said this is what they want to do. From April the 27th it will be free, and we now then need to deliver on the ground the facilities that allow this to happen. So to make sure the staff are there, that they're properly trained, they're properly paid, and the facilities are there. So this will be rolled out across the country, but you can see from what's happening at Rokupa with the pregnant mothers that where you do put in place the facility, it makes a difference.
Okay. There are a lot of other hospitals. What do you intend to do? Because this proclamation is for the whole country. There are other hospitals. What do you intend to do to assist these hospitals to provide these services for the pregnant women and lactating mothers and children?
The Ministry of Health in Sierra Leone has a plan where they're focusing on each individual area and what it needs, and some areas needs will be different. Some may need more trained staff, some may need better facilities, some may need more drugs, whatever it is. So bit by bit, step by step, they want to roll that out across the country. So the important thing is to show that it works, which is why we're here in Rokupa, because it's working here for pregnant women, and then to take that lesson and roll it out across the country.
The government is having more problems with the staffing. What I mean staffing, the doctors are a little bit not well paid, and there are more other problems with the equipment and other things. What are you doing towards that one?
Well, it's partly a matter of organisation, it's partly a matter of resources. And what we're trying to do obviously is get more resources in as well. So this is what we're doing, looking for the donors, looking for the government itself to put money into this. So it will cost money, but that's what we're trying to get.
You should be in a position to give a report card of what you've seen so far, and how is the AGI working?
Well, I think, you know, I mean, our purpose as a group of people is, and my team is based here, our purpose is to come and work alongside the President and his team to deliver their priorities. So one of their priorities is free healthcare for under 5 children and pregnant women. So that's what we're trying to look at, trying to help with the organisation of that. Because, you know, the most difficult thing in politics is you may have a great idea, but how do you translate it into reality? So it's the reality that we're interested in. And the reason to come here is to see the reality.
Okay.
And then the purpose of what we're trying to do is to make sure that the reality here is then replicated across the country.
And